thank everybody for an opportunity to share our experience in doing an environmental friendly audit at Alexandra Hospital. So before we start, I'd like to just give you a little bit of an introduction to who we are. We're a 35-bed accredited hospital in Ingersoll, Ontario. We have 21 acute care beds and 14 complex continuing care beds. We had about 717 acute care admissions last year, and we implemented Home First just in November of last year. So who do we care for? We care for the patients like most of you do. Our average age is 74 years. 70% of our patients are over the age of 65. And our top 5 case mix groups are anywhere from rehabilitation to pneumonia, convalescent heart failure, and COPD. So a lot of chronic disease management.
How can Alexandra Hospital help create an environment that promotes functional ability and enhanced safety in older adults? Well, I've been championing RNAO's best practice guidelines within the hospital for the past couple of years, and I noticed some common threads with senior friendly. So what a natural integration for us to go for the senior friendly, and we went to the environmental audit. We started with that. So before the audit, we already had some idea from staff, from input, unusual occurrences, from families regarding some things that we needed to look at, and they included the entry to the property, the parking lot, physical configuration, the equipment, furnishings, and decor, including paint and flooring. So we looked online and we found Code Plus from the physical design components for an elder-friendly hospital from Fraser Health out in British Columbia. And we looked at that. And why did we choose that? It aligns with our strategic plan. It includes all design elements that impact older adults' health and well-being, can be applied to large-scale new construction, renovations of existing structures, or smaller changes in facility management and upkeep, such as our hospital being a smaller hospital. And it's very user-friendly, and the audit tool was included.
Code Plus also provided us with a framework of the 4 dimensions of a senior-friendly hospital. So we had already done some work in our care systems and processes, policies and procedures, and a social behavioral climate, but we really didn't look at our physical environment much. So the physical audit was a good next step. And when we started the audit, we wanted to use some of our key stakeholders. So we involved some of our community partners, some of our Ingersoll Seniors Services for Seniors was very actively involved in it. Board of Trust members and senior leadership, so we had some key decision makers at the table when we were doing the audit. Frontline care providers, physiotherapists, our rehab team was there was nursing, there was dietary and housekeeping. And we had some team leaders. Our infection control practitioner was there, and I was sitting there as the patient safety officer. We did our audit last October, and you can imagine a hospital that was built in the 1950s and had 2 renovations after that, one in the 70s and one in the 90s. So the physical environment of the hospital was a mismatch of different size rooms, different size bathrooms. Some were wheelchair accessible, some weren't. We do a lot of ambulatory clinics as well, so there's a lot of flow in and out of the hospital from the senior population. A lot of physicians come from London, so that our senior population don't have to drive up there to see them. So there was a lot of patient flow through the hospital.
So the elements that were to be considered according to the Code Plus were the lighting, color, the flooring and the walls, handrails, doors and windows, hallways, doors and windows, handrails, wayfinding and signage, walkways, ramps and stairs, acoustic considerations, parking, equipment, furniture, elevators and washrooms. So we looked at all those areas throughout the hospital. We have 4 floors, including the basement, and we all went through all the areas, and throughout that we found some common threads that were lacking in all areas. Wayfinding and signage, which we've are starting to improve on. The lighting, both interior and exterior, our furniture, some of our furniture was quite dated and we needed to be replaced or it didn't fit the senior specifications. Our washrooms, both public and patient, needed to be addressed. Noise, there was lots of white noise within our facility, and there's always equipment and clutter in the hallways challenging to get through for patients to get around. After the audit was done, I then compiled all the results on an Excel spreadsheet, and we looked at several areas. We put them into gaps identified, then we put recommendations, a plan for change, the date to be completed, and if we had to defer it, the reason for deferral. And then I sent that off to senior leaders.
Some of the things we found in the report was things we could just do. So we were going to be replacing our clock system anyway, so instead of digital clocks in the patient's rooms, we put analog phase clocks, which were more conducive to the senior population. And we also improved our signage. When we were walking around, we found that the signage was very confusing. There was different colors of signage all over the place, so it was really distracting and very, very busy. And some of the things that we met and discussed were when we're doing renovations, we should be always having this senior-friendly gaps analysis in the back of our minds. So when we're looking at renovating, we're renovating our central registration right at the moment. So that was something that we needed to look at, making sure that the desks were lower, there was seating there for people to have a seat. And with anything, after we completed the physical audit and found lots of gaps and places we could improve, we also saw in the other 4 dimensions there was lots of places that we could improve. So there's still lots of work cut out for us. We have been doing some best practice guidelines. We are doing the home first, and we'll be next month starting to initiate the CAM tool assessment for delirium organizational wide. But like I said, there's still lots of work to do. Our ultimate goal is to get to that gerontological excellence and become a senior-friendly hospital, but it'll be a long road, but it'll be fun. We have a great group that works with, so.